G'day there. How's it going? My name is Oliver. It's good to see you again, yes. I understand that you've been referred to us at the Ozone Medical Centre for an unfortunate ankle injury or ankle sprain. Is this correct? I see. Rather unfortunate indeed, but fortunately for you, we were able to slot you into an appointment time rather quickly. The sooner the better when it comes to these types of things. So, before we begin, I just had a few questions I'd like to ask you, if that's okay. Starting with the easy ones. Your name and date of birth. Your full name, please. Excellent. Yes, just confirming the details. Okay, and your date of birth, please. Yes. Excellent. Thank you very much for that. Just update that in the archives. But I did also want to ask you a few more questions, such as any relevant medical history I should know about. For example, high blood pressure or ankle fractures in the past potentially. I see. Okay. No, that's fine. Thanks for letting me know. It's always good to have as much history as possible. Right. Well, just to outline today's procedures, we will be performing a series of examination tests, doing some objective measures, as we call, just to see where your ankle is at, to help me figure out the best course of action for treatment and for speeding up and assisting your recovery/rehabilitation process. Like I said, a good history is always important. So I'd like to begin by asking you a few questions relevant to your scenario. Can you tell me a little bit about, in your own words, what happened with your ankle? Is it the left or... Okay, yeah, that ankle, yeah. Tell me, what happened? I'll just write this down as well for my notes. Yeah, just, when did this happen? How? What you were doing? Essentially the mechanism of injury. Yes, so how it all happened. I see, so. And is this the first time something like this has occurred, i.e. the first incidence, or has it happened before? Yes, I understand. Okay, and did you happen to hear an audible pop or anything like that? A popping sound or sensation, perhaps? Okay, not so much. Okay, that's a good thing. And when it did happen, did your ankle rolled inwards, rather than outwards? Okay, yes, I see. Yeah, it's a lot more common for the foot and ankle to roll inwards. We call it an inversion injury. Inversion, yeah, as opposed to eversion, where the foot is deviated outwards. And this happened how long ago? Sorry. In the last few days, perhaps. I see. Rather unfortunate. Very unfortunate, to be honest. And this was on rough terrain, flat terrain, concrete or bitumen, perhaps, or on a slope versus terrain such as grass or gravel. Where did this happen, essentially? I see, yes. Extrinsic risk factor there, being on an uneven terrain. Just an increased risk there. Those types of floorings. So let's move on. In terms of your pain threshold at the moment, let's see how that is. So on a scale of 0 to 10, 0 being no pain at all, 0 pain, and 10 being the absolute worst pain imaginable. I'm talking the worst of the worst. Where would you rate yourself personally on that scale, that visual analog scale, or VAS as we call it? No need to feel anxious or anything. It's your own perception of your own experience and levels of pain. Only you know how bad it is. I see. So if that's the case, just write that one down as well. It's always good to monitor that number. Make sure it's improving rather than going downhill. Touch wood. Okay. Thank you for that. And in terms of aggravating factors, or things that make it worse, and things that make it better, or easing factors, do you have any of those? For example, weight bearing may be more painful. Not always the case, but can be. More often than not. I see. So, and does the pain skyrocket once you put weight through it, or does it remain roughly the same as how it is now at rest? Okay, so just a little bit more. Alright, understood. And in terms of swelling and pins and needles and numbness, have you noticed any of that in the first few days of when it happened? Or has it been going down, getting better? Okay. I see. Well, that is good. And in terms of your goals, what would you like to get back to? For instance, a return to sporting activity, or return to sport, as well as potentially a return to work. Were there any specific goals in mind? Doesn't necessarily have to be return to work or return to sport. Could be something like an activity, such as being able to do the washing or walk the dog, for instance. It's personal to you. I see. Okay. Excellent. Always good to set these goals within our sessions so that I can help you get back to your specific goal and activity. Again, only you know what you want to do. So, that's good. I think I have enough information to progress now. What I would like you to do now is perform a series of movements. I'm also going to use my hands for some hands-on techniques and tests to try and rule out any other pathology. I think I have an idea of what might be happening at the moment in that ankle/foot region, but I would like to just do a few things essentially for that ankle. If you could please lie down, just make yourself comfortable on that plinth or that bed for me. Yeah, if we can have the footwear off too, please. That would make things a lot easier. Thank you. Excellent. I'm just going to put some gloves on, as I will be getting in and touching the skin. Now, you aren't allergic to any latex or anything like that. Alright. Should be fine. These are nitrile gloves, so we shouldn't run into any allergic reactions. Now, I understand that it is a bit painful in the ankle at the moment. This may or may not make things a little bit sorer temporarily. So, like I said, I'll just go in there with my hands here, have a bit of a feel. Now, if at any point you feel discomfort, or you become quite anxious, or you would just like me to stop what I'm doing, or you have any questions or queries, please do not hesitate to ask me. It's fine, it's perfectly fine to feel a little bit anxious at this time. Keeping in mind you've just sustained an injury. If I can put myself in your shoes, I would be a little bit worried about what to expect when I come into this office. Exactly, it can be a little bit daunting at times, but never fear. Just let me know if there's any issues or you experience any discomfort. Okay, we're on the same team. Right, let's work on your ankle there now. Just let this one relax as best you can. Just going to have a feel on the outside or the lateral aspect there compared to the other leg. Now, no pain on that side there. That one is fine. Okay. How about your affected leg? Let's have a feel now in through there. Okay. Yeah, going very well there. Now I'm just going to get in there quite close there, just in this area. Now if you could please just try to relax that foot as best you can. I know it gets a little bit sore, but just pressing in through there. Okay, you're doing excellently, I might add, so doing very well. Right, I'm just going to apply a little bit of cleaning in through there. Just want you to make sure that you are responding well to stimulus in through here. So, does that feel okay? Okay, is that going well? Excellent. Very good. Okay. Okay. So throughout that whole procedure, that was just a little bit painful, not extremely unbearable, I hope. Yeah, it's good. Well, let's move on. I did have some things I wanted to measure, including the circumference of your ankle there. So this piece of measuring tape will be my best friend today. I just want to measure the circumference of your ankle there. There's a little bit of swelling, just want to monitor that one. So in our next visit, we will be able to compare it to to the previous or today's session. So just winding that one up there. I just want you to relax that ankle, just measuring that one up there. Okay, that is looking pretty good. Excellent. And we'll just now compare that to the other side. Looking at the other side there. Okay. Fantastic. So a little bit more circumference on that affected side, but that is going to be as expected. Could you please now move your ankle just up and down, point your toes up and down, pointing your toes up into a dorsiflex position and pointing your toes down into a plantar flexed position for me, please. Yeah, just like that. Okay, now is that really reproducing or increasing your pain there? I see. Alright, now if I press in on the inside there, does that hurt much versus the outside? Okay, yeah, and I'm just going to move your ankle in a certain direction. I'm going to be moving it inwards, okay, moving your ankle inwards. This is called a talar tilt test. A talar tilt test. Okay, just moving your ankle in there, and then let's see how you go with an anterior drawer test. This anterior drawer test, I'll just get you to slightly plantarflex your foot there. Okay, yes, 20 degrees or so, thank you. Just maintain that position, and I'm just going to apply some anterior translation to that ankle joint, just assessing the ligament laxity, if there is any, as well as the end feel, just to make sure. Okay, yeah. Alright, now, unfortunately those are feeling a little bit on the looser or lax side of things. I think based on what you're telling me with the history, how you're presenting with these little tests and objective examinations, or these objective measures rather, I think we may have sprained our ATFL. I'll just write that one down. Our ATFL. This is a very common ligament to strain when we do an inversion ankle injury. Our ATFL. Hopefully you can read that. But our ATFL stands for our anterior tibiofibular ligament. Our ATFL stands for our anterior tibiofibular ligament. And it is very, very common to be sprained after rolling our ankle or that inversion ankle injury. Inversion ankle injuries make up for roughly 85% of all ankle sprains. It's very common. And the one thing I want you to know is that even though we've had this injury, we are at the highest chance of it happening again in these early stages of recovery. What happens is the structure and integrity of the surrounding structures are affected, as well as the sensory nerve fibers that transmit information up towards your brain. This is just inhibited by the pain and swelling and inflammatory process that's happening down there in the ankle. So, as a result, you're at an increased risk of re-injuring, doing the same inversion rolling of your ankle. It is important that we give it some ample rest time. Try not to do too much activity on that ankle, i.e. too much walking or weight bearing, and definitely too early to return to your sport if you're playing any at the moment. Luckily, it seems to be a lower grade injury, like a grade 1 we're talking about. Grade 1, only microscopic changes. Grade 2, macroscopic changes, but the fibers of the tissue aren't necessarily completely ruptured or torn. Grade 3, that's where that would be the case. The fibers are completely not connected anymore in that area. Just to give you a brief summary and rundown of the grades of strain, ligament strains. So I think we've maybe done a minor sort of grade 1 injury, which is okay for us recovery-wise. Generally between sort of 2 weeks or so, we should notice almost full recovery. But of course, we need to do the right things. First thing being, we make sure we don't do too much activity on that one. I'll just apply some massage cream around the areas there. It's just a little bit tight in some of the surrounding musculature. So please allow me to just use some of that in through there while we explain a little bit more about the recovery process. So, like I said, we're going to rest. We're also going to try and ice that one as best we can. An icing protocol of about 10 to 15 minutes at a time, several times a day. We're also going to be applying some compression. If you've got any bandages or anything like that, that will be perfect for it. Compression bandaging. So let's also try to keep it elevated when you can, especially at night time. Try to keep it elevated above the level of the heart. So, is this pressure feeling okay for that massage? Okay, excellent. And we also want to adhere to this. We don't want to return to activity too early. We want a graded progression, a gradual progression. I'm also going to show you some exercises we can do just to help start reintroducing some weight bearing into that ankle, into that foot. But for the time being, that should be feeling a little bit less tight around those muscles in the ankle joint. Excellent. Okay, now my gloves are quite dirty here, so allow me to just change these ones. Does that feel okay? Excellent. I'll just take these gloves off. Fantastic. Now, so now, like I said, I'll just show you some exercises for that ankle. If you could please now just go through drawing the alphabet with your ankle, almost like you are going A, B, C, D, E, F, G, H, I, J, K, etc. With your ankle, of course. So I'll just make sure I get this moisturizer off your ankle there. Excellent. Okay, should be good there. Now I'm just going to apply some bandaging through there as well. I'd also like you to try doing some seated calf raises. So sitting with your feet flat on the floor, I'd like you to raise your heels up off the floor, just slowly pushing into the floor with your toes, lifting your heel up, just slowly starting to reintroduce some weight bearing into that joint. In the meantime, let's just get some compression bandaging over that area. So hang tight, I'll just cut off a few strips here. Now, does everything make sense so far? now I'm just going to apply some strips in through there, just on that ankle. Okay, there we go. And just worth, if you can, some at home, just some bandages. You might have some bandage at home just to apply a bit of compression in through there, similar to what I'm doing right here. Does that make sense? Yeah. I can email you a tutorial of what I mean in your contact details that you provided to me. Okay, perfect. So that should be good there. Just give your foot a wriggle, make sure it's not too tight or too restricting. That should feel okay though. Excellent. Now, let's continue. I'll just have a quick feel. Can you feel this? Excellent. And can you feel that? Wonderful. Well, I think that will do for today's session. In my opinion, I think it's worth coming back in the next 3 or 4 days, just so we can do a few extra things for that ankle. Like I said before, the incidence of re-injury, unfortunately, with ankles is quite high. Even though pain might begin to settle pretty quickly, in the case of this low-grade injury, low-grade ligament strain, that doesn't mean that the structures, i.e. your muscles, ligaments, tendons, haven't fully recovered. So it's very important, even though pain has gone, that we also manage the structures around and make sure that they can take as much load as possible so that we can reduce the risk of re-injury as much as possible. Does that make sense? Excellent. Well, that will conclude today. I'll let you go outside and have a chat to our admin staff to get you sorted. But let's put that plan in motion and see you in the next 3 to 4 days, if that suits your schedule. So I think that'll do for today. And please, if you enjoyed this video, I would really, really appreciate it if you left a like down below, as well as commented your thoughts, constructive, positive, whatnot, and smack that subscribe button and notification bell for future videos. Thank you very much for watching. I hope you have a wonderful day or night. Take care. Thank you to my awesome patrons, Stephen Underwood, Blaine Bettinger, Jessica Montez, Fading Muses, David Emanuelson, Anthony Espinoza. Here's Mikey, Curious Madcat, Alex Eversman, JJJ, Kenneth Clary, Griffin Kelly, Milano Gardner, Jake Griffin, Josh Santana, Kylie Denton, Stephen Joyce, Joaquin, Megan, Gabriel, Patrick, Troy, Andres Orlan Vasquez, Beth Burton, Keith O, Electra, James Peacock, Michaela Rajanen. Thank you.